Hi guys, this is Rosemary, and I am in Vegas still. And I have a treat for all of you. I found a doctor that is willing to talk to us, Connie and I. And he is a bariatric surgeon, right? Bariatric. And I'm going to have him introduce himself, and I'm going to have him talk to you guys. And Connie's going to have, well, he's going to answer some of our questions. So this is a huge treat. And I know we've only got 15 minutes, so we're going to start right now. All right, doctor, introduce yourself.
Hi there, how are you? My name is Salvador Valencia. I'm a bariatric surgeon. I was trained at UCLA, and now I live in California, and I do international patients surgery in Mexico, Tijuana and Mexico City.
All right. So, Connie, what's your question?
I wanted to ask you, doctor, was that we were like on the table, we were talking about, and I don't think I'm the only one that goes through this, but when we go to eat chicken, it swells up in our bellies, and another person like me, or another person can eat chicken, and it bothers them, where I can eat dry chicken, and it doesn't bother me at all. In fact, I can finish a good piece of chicken breast, as long as it's completely dry.
Okay.
And like this other person, she gets stuck with it, and I don't.
Okay. Well, it's interesting. It's a good question, and I assure you that you're not the only going through this kind of situation.
Mm-hmm.
I have patients who also, for example, are not able to eat rice,
Okay.
and some others do. And you know,
I can't eat rice.
Anyway, so this could probably be the result of two main things. The first one is the size of the gastric pouch.
Mm-hmm.
That would be the first one. Because we surgeons, when we create the pouch, the gastric pouch, the first step to do a gastric bypass surgery, we don't have a really specific measure for each stomach. So we just make a calculation on which size we want to have that pouch on that patient. But it's different, in each case is different. Mm-hmm. So we may end up having 30 cc pouch or 60 cc pouch. And see, that probably doesn't sound like much, but the stomach is very elastic. Mm-hmm. So the size does matter in terms of the volume of that gastric pouch can hold. So that's why some people are able to eat more than others. That's the first step, or the first reason. The other one is the connection between the gastric pouch and the small intestine. And that connection is called a stoma. And so the usual size for a stoma is probably 2 centimeters. But then again, we don't have a way of measure exactly those 2 centimeters. And some patients end up having a 1.5 or 1 centimeter diameter, and some others may have a 3 centimeter diameter.
So they can fit more food through.
So, you know, when you eat, it is easier for that food to go through the stomach pouch and go directly to the small intestine.
I wanted to also ask another question was, I'm afraid of my pouch getting big. How do I avoid that?
Well, basically, you just need to know the size of.
Because I don't want it to stretch, no more than what it is right now.
I totally agree, and then we tell our patients to be careful with that, because you start, if you eat until you feel that fullness sensation, then probably you're eating too much. So we, you know, as a rule of thumb, we tell them just you know, make a fist, and then you shouldn't eat more than a fist size in volume. You know, that would be like a rule of thumb. But then again, each patient is different. So you should eat. That's why when you just had your surgery, I assume you went through a liquid stage, then mushies, mm-hmm. and then solids.
Yes.
So that's we do that to help our patients to get to know their own pouch and the capacity of their pouches. So when you eat liquids, then you know how much of a glass of water you can hold at once.
Yes.
And so you know this is too much for me. And and just remember that, and don't try to
Also,
overdo it.
I wanted to ask about when you're on a plateau,
Plateau, yes.
what do we do to get us off that plateau?
Well, that's a very interesting question because I get that question asked a lot. And the physiology of our bodies that is designed to stop losing weight. If you're losing too much weight, for the body senses that, and then it makes arrangements in the physiology to absorb probably in more and more nutrients, and so you plateau. And what we recommend is that when you are like 3 weeks in a row, you haven't lost any weight, then what you could try is to go back to the basics. Go to liquids. But while doing that, you just need to make sure that you get enough protein. So we go protein shake in the morning, then a sensible lunch, and then protein drink at night. But you need to get at least 60 grams of protein. But you could be 80, So
Okay.
at least 60
So I'm getting most of my protein through the protein
through
shake.
the protein shakes,
So-
and then you don't need to eat.
Because we only absorb, if it's 40 proteins, really we're only absorbing 20. I've always been told.
Well, not necessarily 50%. But it varies.
Yeah.
Each patient is different.
Okay.
But what we do need to make sure is that you get at least 1 gram of protein per kilogram.
Oh, okay.
Okay, when you go to Plateau and you do this little test and you do the shake and the lunch and then another shake at night. Okay, you don't stay that way like for 2 or 3 weeks, right? You wait until your plateau breaks
Yes.
and then you begin to eat
That's correct.
again.
Again, but then you need
Do
to
you-
remember that you need to get like 15 to 1800 calories a day, which
Okay,
is important.
that was my next question.
Yes.
So, I remember my doctor saying, Rosemary, I want you to stay at 700 to lose weight because I have I have a dilemma. I have a very slow metabolism.
Okay.
Now, do you treat your patients that are older the same as patients that are in their 20s?
Yes, at the beginning.
Because especially women, because we go into what is that?
When you lose
Menopause?
calcium.
Because
Menopause.
I'm in menopause right now.
Menopause.
Yes.
You see, because it gets hard. And I'm asking this question for Robin.
Okay.
My friend Robin,
Okay,
she's
Robin.
having some issues, trying to get that weight off, and she's found herself that she's menopausal.
Yeah, well, that's a specific time in women when they need to consider other things, or in terms of getting supplements, which is also important. And our patients, it all depends, of course. It does matter, the age of the patient. But at first, you probably would be all right having 700 calories. But then at some point, you will have to increase that amount of calories, because we usually think that 2,500 calories a day would be the amount that we need to be alive,
to survive.
survive. And if you are getting only 700, then that means the rest it's taken out of your own.
So I'm starving myself.
Yes, you are.
Okay.
So once you get to a point where your fat mass has reduced over 60% of the desired or the ideal, then you should start getting more calories. Oh, and it's very important for you to maintain the intake of protein. Like I said, 60, 80 grams a day, and then the rest of the calories can come from either carbohydrates or fat.
Okay, one more question because it's already at 9 minutes. What do you tell your patients about exercise? How important is exercise to all of this?
It's paramount. Exercise it should be as important as the amount of calories you eat every day, because when you start losing fat mass, and if you are not getting enough protein, then you're also losing muscle. And we don't want that to happen to our patients. So, and the only way for you to increase your muscle mass, it's by doing exercise.
And I think for me, I had never done exercise before.
Okay.
I have to admit, I walked to the grocery store. Walked to the car to get to the grocery store. In the car, out of the car, into the grocery store. So that was all my exercise. So when I started actually exercising and moving around, after the exercise, I feel fabulous.
Yes, of course.
Yeah. Well, what is it that you tell the patients? Do you tell them, do your walking, get a gym membership? What do you tell your...
Well, we start by asking them to do 30 minutes a day. Just walking. Just walk. Move around. Like do cardio. And then we ask them to, to specifically work on different areas of the body, like arms, like doing this exercise,
Right.
or clapping, or very easy to do exercises that help to tone the muscle. So because when you start losing fat, then there's some
You get that?
hanging.
You get that? Is that what you're talking about? You talking about that?
That's exactly what I'm talking about.
But I'm proud of mine.
Oh yeah,
I've come a
you're
long way.
You have. So, but that's basically what we recommend them to do. Just exercise for 30 minutes a day, just walking, and then to try to add something else. With time, 2 or 3 months out, some of them may start swimming, for example.
Yeah, and that's how I started.
It's an excellent.
That's how I started.
Exercise, yes.
And
It
I love
involves
it.
every
One more, and I promise I'll stop because we're at 11 minutes.
Okay.
Once that says 14, we have to stop. But drinking and eating.
Yes.
Just say something about that really fast.
Well, what we recommend in our patients is to when you eat, just eat solids, and then the liquids, or in between.
Are you giving them a certain time, like 30 minutes, 15 minutes,
Not
45 minutes?
not necessarily, because it's in real life it's difficult to have that, time.
Amen.
Yeah. So
I have to
So glad you
admit,
talked about this.
I have to
Thank you.
admit, I do not go eat and then drink a bunch of water. No. I do eat, but I have to have a little sip of water.
sometimes it's necessary.
Just a little bit.
Absolutely, yeah. And again, there's nothing wrong with that. As long as you.
And this is a doctor talking.
As long as you keep your your intake to what you need and nothing else.
Yeah. No, I don't drink.
Yeah.
I just I need that water, that little bit of water in my mouth.
And
That's
again,
it.
that's real life.
Yeah.
Because when you tell them just eat the solids and no water, some people just go crazy.
No,
They just
they're not gonna
can't
do it. Yeah.
put things in that.
Okay,
So-
doctor, we really appreciate this.
My pleasure.
You have done this is amazing. I got a doctor to come up to my room.
With 2 women.
And if you're in the California area and you're interested,
let us know.
He is. Go ahead and tell them where you're at.
Well,
This is a bariatric doctor that does perform gastric bypass.
I do gastric bypasses and sleeves and basically all kinds of bariatric surgery.
Where are you located?
We are located in Tijuana right now, and in Mexico City.
With Dr. Quiroz?
And at Dr. Quiroz Clinic, yeah.
we all know Dr. Quiroz.
It's growing, so he's now asking us to join him in his new
But
facilities.
if our friends want to get a hold of you, they would get a hold of you.
Uh,
Again, say your name.
Salvador Valencia.
And you are in Tijuana.
Tijuana,
At the hospital.
Vida. It's the new Cosmed. It's now
Cosmed.
changing to Vida,
Okay.
which is a larger facility. And well, you will give them later.
Yes. I'll give the information down below.
Okay.
All right,
You have my
guys.
number.
Thank you so much. And this was all for you guys. See you soon. Bye.